Yeah, I'm now live. I think I'm live. I think I'm live. Hey, Facebook members, how are you? How are you? How are you? I just realized I can actually go live simultaneously on Instagram and Facebook. So I've seen something that I'm gonna be doing, y'all. So moving on, what I'll do is go live simultaneously. I'm gonna go live on Instagram and I'm gonna go live on my Facebook, and I'm gonna be able to cater to all of you all need. Um, if you're watching me on Facebook, just um drop some good information, but then I will do a recap for you all and leave it on here in the group so you guys can refer to it later on. How are you all? How are you all? How are you guys doing? It's about to be a new month. We have 2 months left into the end of 2022. I am so excited. I'm so happy to see what 2023 will bring. 2023 is going to be a very awesome year, and that is because you've had enough time to prepare. So by the time you go in 2023, you are actually ready, and that's what I really emphasize, and of course also encourage. So without wasting too much time, I've come to share good news with you guys, and this is specifically for those of you that already have a clinician. All right, if you have a clinician that you're already working with, I think this is appropriate and this is fit for you. And the reason is because all of the services that I'm about to share with you, it's all interrelated. It's interrelated, and you either in it and you just don't know that you can actually do it. So I'm gonna share with you. And of course, if you're not into this business yet, it's something that you should take note of so that when you do become and when you do start your business, you can consider these services. First of all, how many of you guys are aware of what we consider or what we call cognitive impairment assessment? Cognitive impairment assessment. It is an assessment that is actually done by either a doctor, a medical doctor, all right, or that's a physician, or a nurse practitioner. All right, a nurse practitioner can actually do that services, can actually also bill for that. The CPT code for this services, for this service is 99483. Okay, 99483. A clinical nurse, if you're a nurse, even a registered nurse that is clinical, all right, because remember, non-registered nurses have their different specialty, all right. So if you're working with a registered nurse and she's in a clinical field, guys can actually bill for these services. I'm telling you, this is lucrative, and a lot of you guys do not even know about this. All right, a clinical nurse, or of course a physician assistant. Look at this, four categories of clinicians that you can actually work with, because remember, we come to know that a doctor, all right, has the most highest pay grade. So if you can't afford a doctor's rate, because what you do in this business, what we've come to see that is a pattern in this business, is that we work with clinician, right? We work with we call collaborating physicians. Eric, Iri, and I, can you guys go out? I'm on the live right now. So yes, so we work with clinicians. So if you're already working with a clinician, these are the services that you can just offer without you looking or thinking twice about it. So cognitive impairment assessment is a kind of assessment that you can observe. Is you can actually start by you observing. For example, if somebody walks in your office or works into your clinic, your practice, and you observe that they actually some kind of like they have some funny, like, cognitive impairment, you can actually assess and escalate that to your provider. So what this services, it requires, it's either you can also, okay, wait, let me be precise. So yeah, so for those that have contract services, okay, that's just my little note. Detecting cognitive impairment require elements of Medicare annual running basis. So right, so you just detecting that person and you escalate it to your nurse provider. So you can actually, your nurse provider can actually bill for this, and you guys get to have that assessment, whatever, in your facility That is if you're already working with a clinician. If you have a nurse provider, that you're a nurse practitioner, I think you guys can consider this services. All right. And it's actually either done through direct observation, like I said, just by direct observation, or it's also routinely. It's something that it can be, you guys can bill for routinely or yearly. All right. So, and this can actually be done via telehealth. I see a lot of people ask me that, oh, telehealth. This is one telehealth visit right here, and that is when your doctor, they don't have to come into your facility. Everything can be done virtually online. So telehealth visit. All right. So you guys can consider doing that. If you have questions precisely on cognitive impairment assessment, drop it in the comment. And I think I already have posted this in the group. So read more on this. It would make sense. All right. I've already shared the resources with you. So go ahead and read, and you guys can bill for this. I already dropped the code. The code is 99483. Y'all can do this, and it doesn't have to be it can be done in the office, in an outpatient or inpatient platform. No, not platform, like or in office or outpatient. It can be done in their homes, like private, in a resident home, in a care facility, or via telehealth, or even in a rest home. So Medicare reimburses for this. So if you already have an NP that you're working with, they allow an NP to do it. They also allow a PA to do it. Allows an RN, who is actually a clinical RN, can also bill for their services. All right. Let's talk a little bit more about molecular testing. All right. Molecular testing is something that you guys can also offer. For those of you specifically that are working in the nursing home, if you're already working in nursing, if you already have a contract with a nursing home, because that's where one place that we actually can go get service. If you're looking for services, we target nursing homes. So if you're already in the nursing home system, either you're drawing blood for them, doing routine and stats, you can actually also market for molecular testing. You can put that in your thing and say, one of your test menu, right? Your service menu. And what the category, the testing that falls under this molecular testing is the CGX, PGX, and PAD. Let me stop live on. Right. So PDX, sorry guys, PDX, PAD, PGX, and CGX. CGX, you can actually, that's cancer screening, where you get to screen for cancer. All right, so it's something that you can also do, guys. Take note. You would screen for cancer, you would offer CGX, and that test helps you identify those that are in risk for cancer. All right. Also, the PGX is the pharmacogenetics testing. It tells you how your genes affect the medications. We've seen this a lot of times in the older population. So if you're in the nursing home, I think you should go ahead and market the services to those people that you're already serving. In labs, I actually have a lab that can work with you, or that you can work with them. They offer these services. A lot of you all do not actually offer this, and I don't know why you guys are sleeping on this. PGX and CGX is a very good test that you guys can offer. All right, that screens for cancer, and the other one screens for the medication. Let's talk a little bit more about UTI. I'm very sure that you guys already know about UTI. That's one of the common ones that you already know, right? But then you guys don't know about PGX. So if you're doing UTI, I think you should do your UTI screening simultaneously with the PGX, because if you go back to your room, because we are looking at medication. UTI, these other folks, they have UTI because of the medications that they are using. So you can say, or you can also, I mean, you don't even need to say, but you should know that if medication is making them have this much UTI, is the same screening that you want to adopt, which is the PGX. All right, if you have more questions, we can answer that. And PAD, that's the, also for the older population. Again, this is for you that already have a nurse provider that you're working with. So if you have a nurse, if you have a nurse practitioner, you can actually offer all of these services simultaneously. It's on your test menu. That's broad and expansion of services, correct? So PDA is Pakistan Alzheimer's and dementia services that you can offer. This is specifically you working with researchers. I've seen a lot of time people are in research. Research needs evidence based, right? They need to have evidence. You can't do research if you don't have evidence. Every other research needs to be evidence based. So, and how can they have evidence? Is through you, because you guys have the data. You can look in the system and collect and say, oh, women of this age, we've tested them and they have cancer, or they have tested to this testing, right? You've screened them and they tested positive, right? So this is how you can work interrelated with a researcher. Researchers are actually looking for laboratory diagnostic lab people because they need data. They need data, and if they don't have the data, they want you to be part of the team. They need you on board, because remember, the medication that they are prescribing, researcher, right? The pharmacogenetic people that are into pharmacy, pharma, it means drug, medication. So those that are into this medication system, they need to find medications that they will want to prescribe. So you see how everything is vertical, right? You see how you are in, it's an umbrella. So pharmacists, pharmacogenetic people, doctors that will prescribe the medicine. They don't make the medicine, but they're going to prescribe. So they need to know what the medication works for, right? And they also want to collect data. You are responsible for testing and data. Let's not waste too much time, but these are the services that you can actually offer in this in your lab. All right. And what PDAD screening also does is screening for pain, psychiatry disorder, and cardiovascular disorder. All right. So that's that. Recap, you want to do cognitive impairment assessment, and you want to do molecular testing. The most common one for the molecular testing is CGX and PGX. All right. I see a lot of I've seen some girls actually offer that services. I know one or two people in my group that actually have that services going on. Of course, the common one that you guys know is UTI, STD, STI. Again, if you don't have a doctor, if you don't have a nurse provider, if you don't have a provider, all right, you can't provide the services. So if you already provided, like me, like my agency, we have a provider. We offer the services. So I would consider definitely doing these two services that I just mentioned. So again, UTI, you can offer it to the other population because they tend to have lots of UTI frequently because of the kind of medication they are using. And these actually can be done via telehealth. At the end of the day, when you test, your doctor, your clinician can do all the services via telehealth. I know there is one person that was asking about telehealth. So we've been able to identify 3 services that falls under telehealth visit. All right. And lastly, I want to talk about pre-op and post-op. Is becoming to be a norm in the drug testing business. Not drug testing, but diagnostic lab. And that is because we are required to work with clinicians. So if you already have a clinician, you can actually offer post-op services. Go ahead and do post-op. No, pre-op. Let's do pre-op first. Pre-op is before these people go in for surgery, they want to do beauty surgery, enhancements, all those good stuff, right? They need to do COVID testing, right? And they also need to do physicals. That's everything that consists of pre-op. Like my nurse provider, every Friday we open our calendar for pre-op. So people come in actually to get physicals done, and sometimes they actually have to go out of state, popularly in Florida, for their operation, right? So they need to be physically cleared before they can go in surgery. So your nurse provider, your practitioner can actually offer the services. So again, these are layers of services that you can offer if you are already working with a clinician. And if you're not, eventually you will, because remember, clear, right? Some states, for example, my state, you have to have a doctor before you can actually have your certification. All right, let's not waste too much time. Again, if you have any question, remember to drop this in the comments. Lastly, did I say lastly before? And not lastly, but now, so again, y'all should consider administering COVID vaccine. Vaccine is it has come to stay. All right. We have something we call VFC and non-VFC. VFC is for kids So if you're working with babies, like, but then I don't think, yeah, that's something that you guys can actually do, because children, they take vaccines from birth to whenever, right? So VFC, but that's more comprehensive. Okay, so if you want to do VFC, you guys gotta be like, again, it's doable, but then that's more comprehensive, and that's more reporting, and that's more compliance that you have to go through. But if you want to stay in the minimum level, okay, you can offer vaccination, COVID vaccine. You don't need nothing to, you don't need to be more comprehensive. What they are just requesting for of you is to always report back to your state. Okay, so that's why when you want to do COVID vaccine, you have to go through your states. I just did that, so I confidently know what the requirements are, so it's doable for us. And I was like, I was trying to go into VFV, but then, hey, the requirement is just too much for me. I'm like, this time I'm just gonna keep it simple and keep it going. But of course, long-term goal is for me to get into that. And again, my long-term goal is for me to have my own clinic. All right, so we want to practicalize, we want to test the water, we want to have a feel before we become a full-blown clinic. So that's why I'm presenting this to you guys to consider, especially again, if you're already working with a clinician. I think these services are right fit for you. So let's do recap. Okay, cognitive impairment assessment is something that you guys can do. All right, cognitive impairment assessment, molecular testing. Guys, if you're already working in the nursing home, this is what you want to do. You want to consider working marketing for PGX and CGX. Those two will give you money, more money. You're already there, you already want to do it. All right, and it will allow you to do telehealth visits. And again, we already know, again, some people actually want to do post-op, and I'm beginning to see that we have a lot of home care agency owners. Those are in the home care agencies. Even staffing business, it's intertwined, right? If you don't necessarily be the one to be the provider, you can actually staff that position, right? You can be to either you do staffing, or your home care agency takes the services. You send your caregiver, because you need caregivers. They need caregiver after post surgery. All right, post op. So post op, for those of you that are already in the nursing in the home care business, for medical and non-medical homes, I think you guys can do that. But don't quote me on that. But I want to say non-medical home, medical home, because surgery care afterwards is wound care, so it falls under medical homes. So those of you that are in the medical homes, this might also be something that you want to consider, because again, all of our services are interwoven and interrelated. It's all health services. Okay, yeah, but definitely we all can do pre-op, because pre-op is just all about testing, and the doctor is saying, hey, they're good to go, they can go on that surgery. Y'all can cut them. All right, so they need to be physically fit, be healthy, and everything again consists of blood work. So you see how it's related. Before you can go in services, you gotta draw your blood. You gotta know some levels, your iron, anemic, all those good stuff that they're looking for in blood. Again, guys, this is for your next level. I'm dropping this gem because I want you to start thinking of the next level. We want to go on our next level, and that's 2023. So again, this is all I've got for you. I hope I've been able to bless somebody tonight. All right, so let me see if I have comments. What are the types of clinicians? Good question. Vanita, here you again. So the types of clinicians are doctors. Remember, doctors, registered nurse for a particular service. All right, a registered nurse fits on the first one. Drop the name of the first one if you know what I'm talking about. Then PA, physician assistant, that's one person that is allowed to do the first one. And PA, clinical nurse, NP, nurse provider, a nurse practitioner. So you already have a nurse practitioner, go ahead and do all of the services that I just mentioned. All right, let's see, any other question? Right, so that's that. All right, because again, you guys are always I don't mean to say you guys, but like a lot of us, like, we commonly just want to do drug testing, which is nothing wrong in it. Drug testing, what else do we want to do? What else do we do? COVID test, DNA, fingerprints. Again, this is everything else that you can do. Did I answer your question, Fanita? Yes, you are late. But again, Stephanie, this is always recorded. You can go back and listen. That's why I don't always like to do a long video, because I don't want to bore you guys. But then this is gems. So again, make sure you go back and listen. And if you have any question at the end of this, reach out to me and I will help you navigate some. I like doing research. I'm a researcher, so I love to research. And that's how I got to know all of this, you know. I don't want to be, yes, love. Say hi to everyone. Hi. Oh, my baby has runny nose. All right, go clean your nose. All right, guys. Let me see. Do I have any other thing else here? Yeah, your state doesn't require a physician for some certain services, but not this ones. These are clinical. Yeah, it does not mean so because you want to offer these services, Fanita, then you have to seek a clinician to work with. Except if you're a clinician. If you're a doctor, then you don't need to seek a doctor. You can just go ahead and do it on your own. But again, you want to take your business to the next level because there is room for that. So why not do that? That's what I'm saying. Any other question? Yeah, I love you too. Love you, Stephanie. Let's talk. I sent you a message. Let's talk offline. All right, guys. Bye.